government hospitals are registering an increase in admissions, placing a strain on both the public and private healthcare system. To talk more on this, we're joined by acting Gauteng Health HOD, Dr. Sibongile Zungu. Dr. Zungu, good evening, and thank you so much for your time tonight. Hospital capacity in the province was always at risk of being breached. Talk to us then about the situation on the ground.
We do have a challenge at this point, even though we still have capacity. But should we exceed our daily numbers, we will run into challenges for both public and private sector. We are getting very close to our threshold, and we are each day opening up new additional beds. So when we started off, we had prepared 4,050 beds in the public sector, and these days, yesterday, we actually shot up to quite a high number. We're at 3,090, and then we also had discharges, but we have increased again. And at this point, our bed states is looking at we have capacity for about 217 beds. But what is good is that as we see that we're approaching the threshold, we then repurpose beds within the hospital where we start utilizing other spaces, shifting the beds and making space there. But it is becoming a challenge at this point, as well as in the private sector. Also, we are aware that the cases are going up, and total admitted cases in the province are 8,835 at this point.
And when you then look at this capacity building efforts that you talk about, is it only simply about utilizing some of the spaces in the hospitals, or are you then reimagining using other spaces as well in order to ensure that you'll have enough bed space?
In the public sector at this point, fortunately, we do have additional capacity that was created through infrastructure development, using a quicker technology to build infrastructure. However, the challenge there is that it becomes the human resources to cover all those spaces. And in the private sector, it is a situation where in some of the hospital groups, they have brought in additional space by bringing in containers and other makeshift spaces to ensure that we increase the number of beds.
And could we see a situation where field hospitals make a return like Nasrec?
At this point, we don't think we have exhausted all the capacity that is there. The challenge that we have is human resources. The spaces are still available, but it will be the human resources that will pose a major challenge for us. And we even have the health technology to go with the spaces. We have the ventilators. We have the bulk oxygen tanks. The critical area that is a challenge is the human resources.
And how are you planning to navigate then that particular challenge of human resources? Because we saw just a few weeks ago some doctors saying that they would like to be placed in order to start with their training, and they want to then be able to be absorbed into the system. Is it simply an issue of finances, or is there more to this?
It's both. It is the finances on the one hand, but on the other hand, it's the numbers. In terms of the output for training of our health workers, the type of communicable disease like COVID-19 and epidemics were not really anticipated to be at this level, even though the training projections were done, but it was not at this level. And therefore, at this point, the challenge is also to find a pool of available nurses, doctors, physiotherapists, pharmacists, and all the other healthcare categories. So that is the challenge that we have at this point. But also, we are at a time where we have a financial crunch, and the health budgets have been cut over the last 3 years. And if we are projecting looking forward, we're also going into a period where we are going to be having budget cuts, getting our budget static. And as such, it is going to be difficult to maneuver the space if we are having a sustained epidemic like we do have at the moment with COVID-19.
So how do you then keep the health workers going who are now crying around fatigue and also not being able to get enough rest because there's simply, there isn't enough people to be able to relieve them of some of their duties?
For the province, also working together with the National Department, Health Professions Council, the Nursing Council, the Pharmacy Council of South Africa, we are looking at a release of some of the students that are in their senior clinical years to also come in and support the professionals and do some of the duties that they have been trained to do so far. And the universities in the province, we've met with them, and the supervisory function and all the requirements to ensure that we do quality work are being put in place, and we are now also planning with the vaccination of the students. We've started in some areas, and in some of the places we are still going to start. So as we prepare the students, who are going to be bringing them in, and they will be coming into the area of clinical care in the main, and especially in the areas where we have patients that require observation and are not really the high-end complicated cases, but to ensure that there is a clinical care that is provided to our patients.
And which areas would you say in Gauteng have become extremely problematic? Because we have seen concerns even around Sandton and, the Johannesburg CBD. Which areas tonight, as we speak, would you say, officials are worried about?
Well, we are worried about Johannesburg and Ekurhuleni as a whole. There are hospitals that have been under pressure for the whole week. It might have come to the public knowledge that Helen Joseph Hospital, for instance, had its challenges. We had to move patients to Baragwanath, Chris Hani Baragwanath Hospital overnight, and Betha Kowa also came under pressure. The oxygen systems there were battling down, and fortunately Afrox came into the rescue and worked on the issue, but the patients also had to be moved en masse. Fortunately, we have that structure at Barra that has a huge capacity, so the patients were moved there to relieve the pressure. But the beds are filling up quite quickly, and in the public sector, we saw that the beds the admissions were increasing, even though in the public sector they reduced a bit, but it was only by 4 beds when we compare last night to tonight. So we are very closely looking at the situation. We do have senior managers that are on a medical officer call and are administering the bed availability during the night, and to ensure that we know where to take the ambulance and which hospital has the beds at this point.
Has the lockdown helped at all?
I would say the lockdown has helped because the load of patients in the trauma areas is lessening, is quite low. And even today, I did have an opportunity to look at the trauma section in one of the hospitals, and they said, you are lucky you are coming in at this time. It has been quiet for a number of days, and for a weekend, this is amazing that it is like this. And it was very few patients with the health workers working there comfortably. But when you moved to the next section, which was the medical emergency section, it was full. And they have even crowded out the surgical section, and the surgical section is now being used as a medical section because of the cases of COVID-19 that we have.
While we talk about the burden that appears to have been eased somewhat at the trauma units, when you look then at the reality of this wave that we are finding ourselves in, death has been the true burden here. Wouldn't you agree?
It's unfortunate, and it is one of those areas that hurt, because it's the deaths amongst the family members in the community, but the deaths are also within our health workers. And it does become a very heavy load on the health workers that are remaining to do the work. It is at management level, it is at facility level. We are losing some of the health workers, albeit not at the same rate as it happened in the first and the second wave.
And when we then look at some of the challenges around the vaccination rollout program, there's been criticism then that it's really been slow and it should move at an accelerated pace to ensure that we try and prevent further deaths.
Indeed, the vaccination program was hampered by the different challenges that started at the beginning. And at this point, it has been ramped up, and with the start this week, at the beginning of the week, there was an outreach program which was now going out to the communities to ensure that the vaccine program is brought to the communities, and also there were arrangements where the communities could also be moved to the facilities with all the COVID-19 precautions taken into consideration. So we have seen quite a marked increase in our daily numbers of the vaccination, and we are looking at partnerships with private sector. We've already started in the Gauteng province. We've seen the private sector coming in and opening up for public uninsured patients as well. So it has yielded results in upping the speed of the vaccination program.
Tomorrow, the Command Council is meeting and they are reviewing the lockdown restrictions that we are currently under. Some have said that they should leave them at alert level 4. What do you say tonight? What should they do?
If I were to consider one variable, the health system challenges and the challenges to the health workers, and the resource constraints that the health system has, I would really pray for a continued level 4, because we see the gains in our casualties, but the load of patients is also increasing. And I think that is giving us, there's a window period that we are having. Even if you observe the Gauteng numbers, at some point last week on a Saturday, we were at 16,000 plus. And today we are at 10,770. So there are some gains that we are getting from the lockdown. And hard as it is, but the health system will benefit.
Should Gauteng be getting stricter restrictions?
At this point, in terms of the movement of people, the observations from the surveillance team is that the movement of people has gone down. Perhaps if we all respect the lockdown regulations and adhere to the non-pharmaceutical interventions, we could remain at level 4 as Gauteng, like the rest of the country, because otherwise people could do other things in other provinces. And if we are all in the same boat, there is no need to try and escape from Gauteng, which might bring complications maybe in other provinces.
As a final question then, Dr. Zungu, we saw the passing of Mayor Jeff Makubo. What's your reaction then tonight?
We are very saddened by the passing of the mayor. And we wish we could stop the deaths that we are having at all levels, because we are losing leaders, we are losing professionals, we are losing people in the entertainment industry. In Gauteng alone, we have lost so many people in all sectors of life. We are losing religious leaders. So it is upon us as individuals to ensure that we adhere to the regulations, and also ensure that we protect each other and protect and adhere to the non-pharmaceutical interventions for the sake of others.
All right, Dr. Zungu, thank you so much for your time tonight. We certainly do appreciate it. That's acting Gauteng Health HOD, Dr. Sibongile Zungu.